what you mean. This, okay.
Are you okay if I just bring my computer up there and look at that? That way I can.
Yeah, you can do that. Yeah.
That way.
Yeah, you can do that.
Okay.
Yeah. Let's put on those. Is it? If we put that, did you connect that to the thing?
No.
Okay.
Actually, that is a good point. I was dealing with some other little shenanigans. Just a few. There we go. We are. Hold down the little button.
Yeah.
Okay, now it's off. So yeah, you'll just hold
It's
down
official,
that button
Scott.
until it goes green.
Love it.
All right, gang, we're about to get started.
Okay. Yeah. Why don't you guys come up here and then we'll all introduce us. I'll start the spiel, and then I think it's Kim, and then Scott, and then back to Kim, and then me. Just kind of how it goes.
Okay.
So we can share the microphone.
Okay.
Yeah.
And if anyone is having difficulty hearing us, please let us know in the comments, and we will.
Are you on live? Cool. We're on live.
We're
Ah.
live. We have one viewer, and I bet she is Chelsea.
Oh, okay.
She said she was going to come in and support us, so that's why I'm figuring out it's probably is Chelsea.
So, off here. Okay.
All right.
Yeah. Cool. All right. Well, hello, everyone. We had a little bit of technical difficulties, but we are here, live and in the flesh,
Absolutely.
the Pinnacle Dream Team. I'll introduce us. First, on my far right is Dr. Kim Weiner. She is a doctor of physical therapy here at Pinnacle PT, has been a PT for a long time, brings an awesome skill set to our patients. In the middle is Mr. Scott Buck. He is a neuromuscular massage therapist and has a wealth of knowledge, a very unique approach to treating patients, helping them advance in their physical therapy to get back to doing their activities pain-free. And then myself, I'm Dr. Brian Murphy. I am the owner of Pinnacle Physical Therapy and been a PT for 10 years, and just looking forward to sharing some great information with you guys with this awesome team that we have right here. We're going to talk about, the presentation is going to be 5 tips to help you reduce your low back pain or back pain in general without needing medications, injections, or surgery. Yeah.
That's the goal.
Yeah. We're conservative. We're conservative medical providers, so we want to keep you away from this stuff. And certainly that as a last resort is an option, but we want to make sure that you're getting great collaborative team care and that is successful for you before you would have to go do something more invasive. Yeah. Makes sense.
Makes sense.
Yeah.
Absolutely.
Yeah. Okay, so
Mr. Murphy.
all right, so did you know that low back pain is not usually associated with a specific identifiable pathoanatomical cause? So what exactly does that mean in layman's terms that you can understand? This is a really interesting statistic, and this is why sometimes that biomedical approach, going in to see a physician and getting an x-ray or getting an MRI to start, is not always the best option, because a lot of those patients, even some of those patients that don't have pain, there will be changes on those films that are scary to the patient. Degenerative disc disease, disc herniation, stenosis, all of these big scary terms that they don't necessarily tell you are just normal aging processes. So like the presentation shows, it says 85 to 95% of people presenting to primary care providers do not have a specific identifiable origin of their pain. So we don't really know. A lot of times it could be coming from places we don't necessarily think is where the pain's coming from.
Right.
And that's why we've got to look elsewhere to treat the patient holistically to get them the outcome that they're looking for. So the other did you know fact low back pain is a common global problem. I mean, we kind of understand that. But what's interesting is that the prevalence of low back pain, and this was back in 2017, was estimated to be about 7.5% of the global population, which doesn't seem like a lot, but then you hear the number 577 million, and it's like, wow, that's a lot of people. It's a small amount of global, but it's a lot of people that deal with this condition and that need help. What do all people who have pain want? Well, this is fairly logical, but they want to make sure that the pain doesn't interfere with their quality of life. They want to not rely on medications, avoiding surgery, avoiding injections. They want an explanation of what's going on, and they want a plan. So that's all something that our patients tell us all the time when they see us, like, hey, this is something that we want, because we hear this from our patients all the time who we treat with low back pain every day. So in summary today, we're going to be answering some questions. The first of which is, what is wrong with my back? The second of which is, with Pinnacle's approach, what can Pinnacle's approach do to help you feel better and get you back to doing the things that you enjoy? And third, some tips, 5 tips, that we're going to give to help you help yourself. So, the first of those questions is this. Dr. Murphy, what is wrong with my back? Well, there are quite a few different types of low back pain. There's chronic low back pain, there's acute low back pain, acute being I just bent over and picked up something that was heavy and I hurt my back. There's non-specific low back pain. There's low back pain with radiating symptoms, potentially from a pinched nerve. And then there's also low back pain from spinal instability, where you might have a malalignment of your vertebrae. So there's a lot of different medical diagnoses for back pain, but we'll talk more about why that isn't always the correct answer to treating patients. So a pathoanatomical approach deals with some physical causes for pain. For this patient, we can see that there's an anatomical reason why this patient is having pain. A surgeon went in there and did what's called a lumbar fusion. Pain was coming from the back. They felt like fusing the vertebrae with rods and plates was the best option for this patient. We can't ask the patient what their outcome was, but that is a very anatomical problem that was approached by a surgeon who made an anatomical correction to that person's spine to hopefully help them reduce their pain and get back to some function. So that's an anatomical approach to pain. We've got 4 people. Yeah.
Yay.
4 people. Man, we're famous, guys. This is, man, yeah. All right, so what's wrong with my back continued. Now we're starting to take more of what's called, and it's funny, we just had this conversation about a patient we were talking about before the presentation started, a biopsychosocial, it's hard to say, approach to treating our patients. We've got to see them as a whole person, the emotional, the physical, their goals, their desires, their background. When you're treating a patient, you've got to account for all those factors, because those factors make a difference in that patient getting the outcome that they're looking for. So, what can create the pain response? Potentially job satisfaction. I know that's not a problem here. Highly satisfied people working at this facility. They're trying to be. Yeah, right, exactly. Yeah.
Absolutely.
We're live on TV, so be careful.
There's food at the end.
There's food at the end, yeah.
At the end of the rainbow.
Yeah. The chronicity of the condition obviously can dictate what our realistic expectation is for our patients. If you have 30 years of low back pain, tomorrow we're not going to be able to get you 100% better. very logical. Type of work performed. Are they a factory worker that maybe lifts things all day? Are they doing repetitive tasks? That's going to be a factor. Psychological factors. Are they stressed? Are they sleeping? Are they depressed? Are they eating well? Some of the things that can help with healing and can help with sensitivity. Scott's going to talk about the nervous system in a little bit, and that sensitivity to the nervous system is affected by all those things.
Absolutely.
Other comorbidities. Obesity, are they smoker, are they diabetic? That's going to prevent healing, and those are all factors that we've got to account for.
Inhibit blood flow.
Inhibit blood flow, that's another one of Scott's areas of expertise. Yep, so what's wrong with my back continued? Making a diagnosis. So this is kind of back to that, we're beating a dead horse here, but the MRI, this was an interesting study that looked at some working men between the age of 20 and 59, and they did an MRI, and they actually found that 32% of asymptomatic patients, so they were patients who had no pain whatsoever, they had abnormal lumbar spine imaging, which is like your degenerative disc disease, your stenosis, your disc herniations, all of that stuff. 32% of the patients who didn't even have pain had all that bad stuff. And then they looked at, further down, 47% of all subjects in that group, they looked at 149 working men between the age of 20 and 59, so about 150 people. Almost 50% of them, let me go back, 50% of them who had experienced low back pain had normal imaging. So there's not a whole lot of logical reasoning there. Now, some patients, we're not saying that imaging is bad. Imaging with an appropriate examination that matches what the imaging shows is very good. That helps our patients get to where they need to go much faster. Imaging does not need to be done right away. For the vast majority of cases, if it is, we can help you explain some of those red flags and get you to the right provider. We can actually make a referral for you to get to the right person to get that imaging that you need. But oftentimes, the vast majority of the cases are not something that need imaging early on. But if you go to somebody that does imaging, they're going to image you. Yeah. So it's,
Take a look at those images.
And you may not need it.
and you may not need it. Yeah.
Yeah.
So not to say that it's not appropriate at times, but the vast majority of cases don't need it. So
Who doesn't want some pictures of their insides, though? Come on.
that's true.
Seriously, who wants to verify
very
where their pain's
expensive.
coming from?
Exactly. That's very logical. I mean, people want to know where their pain's coming from. But if you're looking at images from the statistics we just saw, it's not necessarily coming from your back.
They're going to your back from your shoulders. It could come from your glutes.
A lot of different areas. Yeah.
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 Feet.
Feet. Scott's going to get
I mean, it's
Scott's. Yeah.
Various organs, too.
Various organs, yeah. Referred pains, sinister pathologies. I mean, we're not going to, yeah. There are things that if you've fallen off a roof and you hurt your back, don't come to your physical therapist. Very unlikely that trauma is going to need to be looked at and x-rayed to make sure you haven't fractured your back. That's probably a situation, or a motor vehicle accident. That's another one where it's kind of high impact force, could be a fracture. PT is not going to help you with a fracture necessarily, depending on how bad the fracture is at the beginning. Yeah. So things to be aware of. Education. We're here to educate you on breaking down some of the bad information that's out there. And it's not biased towards physical therapy. It's just this is what the current research tells us. Yeah. So, all right, Dr. Weiner.
Yes. We're going to just talk about what a physical therapist does to help with low back pain. And our physical therapy goals are primarily to decrease pain, because if you're in pain, it's hard to perform the activities that you like to do every day. It's hard to sit or stand at work, hard to walk around in the community. And so our primary goal is to get rid of your pain, but also to restore your mobility and function, to get you back to what you need to be doing. And we'll go through that a little bit more in just a couple minutes. And then also to educate you again, like Dr. Murphy said, in how to not only transform your life, but to progress to where you can hopefully help prevent the injury from reoccurring again and do things to help your overall health and wellness.
Yeah.
So the main ways to do this are through an exercise program, which everybody knows that physical therapy is big into exercise. You know, I tease my patients all the time that PT stands for pain and torture, and that's not really the case. Because
So do I.
That's great.
actually, you know, especially if you are in a lot of pain and you're kind of nervous about doing any exercises, we're going to grade those exercises to make them easier for you and, you know, modify things until you feel more comfortable, till we've helped to decrease your level of pain, and then we can progress you further with the exercise program.
And Scott's going to talk a lot more about this. It's not a segue yet, but this is kind of where we feel like Scott has a really unique role here at Pinnacle in our team.
So we talked about exercise, education, also just hands-on therapy, which is one of the biggest things that we do. And Scott will talk a little bit about that, but I'll kind of go into some of the things that we do with that. We like to work on soft tissue tightness. We try to, you know, we can do techniques like myofascial release, and fascia is the layer of tissue that lies between the skin and the muscle, and that can get restrictions in it, and we can work on loosening that up because those restrictions can cause pain. We can work on trigger point tenderness, where a bundle of nerves lies superficial in the muscle, and you can put pressure on certain areas and it's pretty tender. Flexibility, whether it's from like decreased movement from tight muscles or joint arthritis, we can help improve that. We can work on mobilization of the vertebrae individually if there's tightness there. If there's increased instability, we have to be careful of that, but we can check for that too with our hands-on approach as well. So, and the last thing is just to get you back to resuming the activities that you like to do, like whether it's walking or hiking or biking, back to work, pain-free. That's our goal as well, to get you to where you need to be. So, and I guess like it says at the bottom, or we missed that, but to return to your life.
Yeah.
So that's what we're implying. And like Dr. Murphy alluded to with the article, an article that I found, was published in 2018, and it is a physical therapy approach to the treatment of low back pain. And they mainly looked at patients with nonspecific low back pain, but they really recommend a non-invasive approach for that type of back pain, which includes remaining active, like we talked about, patient education, and then exercise therapy. And then they really recommended that physical therapy is one of the most important things to get back to your normal activities of daily living and work. And then, like Dr. Murphy alluded to as well, cautious use of imaging, medication, and surgery. So they didn't really promote that, and that's just kind of on an as-needed basis, rather than to try to have every patient go through those particular treatments, because generally physical therapy can help with your low back pain and you don't necessarily need to be imaged or, to be on the medication. So.
100%.
So Pinnacle's approach and feeling better. What do we do? First, we like to take a history from you when you come into the clinic to find out, first of all, your mechanism of injury, if you know what it is. Non-specific, of course, is you're not going to know, but we also like to know what your pain level is like with activity, what makes it better, what makes it worse. What is your posture like at work? Do you sit a lot? Do you stand a lot? Things like that. We also like to check on, not only whether you have a history of diabetes, but also maybe a history of arthritis. Could that be causing some of the pain in your back? A lot of times people over the age of 60 have arthritis somewhere in their body, and so that could be a factor in your level of pain. Do you have osteoporosis, especially in females over the age of 50? If you have osteopenia or osteoporosis, you're going to be more likely or more susceptible to fractures, and the biggest areas of fractures are in the wrist, the hips, and the spine. So that's something to consider as well. Plus, it also can lead to kind of a kyphotic or forward hunched posture, which can make you more susceptible to fractures.
And it's not aesthetically pleasing.
No, hunchback. What are you gonna do?
That's yeah. I mean, and honestly too. I mean, sometimes it's a good motivator. Pain. We talk about it. Pain's a motivator. Like if your posture it can affect your mood. It really can. I mean, we have patients that come in and my self-image is affected by this kind of forward posture, and that to them is important.
Not able to bring your neck up all the way.
Yeah, looking up, scanning your environment. Those are like real life concerns that are very well alleviated by some of the techniques that we use. So
Yeah.
Absolutely.
And not only that, it'll, if you're in that forward rounded posture, that can also put increased pressure on your organs too, making it harder to breathe. Your diaphragm can't
Open all the way.
push up into your chest cavity like it normally would.
Can't really expand.
Yeah.
yeah, ribs can't expand, digestion, you name it.
Yeah.
There's a lot of other side effects that aren't good.
No.
Yeah. So then what we do is after we take your history, we'll go through a physical exam. And we like to look at your range of motion in your spine. We like to look at your mobility. Like I said, whether you're hypomobile, you don't move as well as you should, or hypermobile, where you're moving too much and it could be a little unstable. We look at your flexibility in the hips, in the spine. We look at soft tissue tenderness and tightness to see, which areas we need to work on. And then also if necessary, if you have radicular symptoms, which means you might have radiation from your back into your legs, and sciatica is one of those diagnoses where the nerves from the spine come together and they go down the backs of each of your legs. So you may have pain in your back, but you may also have some pain-like symptoms down into your legs.
It can transfer down to the legs and hamstrings.
Yes. Yeah. And
That's a common one that you'll hear, sciatica. I got sciatica. Everybody has sciatica.
Yeah.
At some point,
Yeah.
everybody's had sciatica. But what do you do about it? Are you looking at the root cause of the problem and assessing what are some of the things that can be done to attack the root cause, not just treat the symptoms?
yeah.
We don't like to treat symptoms because that just means you're going to have to come back again. We want to try to get to the root cause, educate you, empower you, calm things down, get you back to activity. That's kind of our bread and butter.
Yeah.
Stretching. It's all about stretching.
Flexibility, maintaining your flexibility. Are you doing any flexibility? If you're not, well then you know you got a problem. Are you doing it appropriately based on your exam, right? I mean, you may not need to stretch your hamstrings, but if you're stretching your hamstrings all the time, you're kind of wasting your time. You know, not everybody has tight hamstrings.
Right.
I got a patient that put both hands bent forward, put both hands. I'm like, you got better flexibility than like the Rockettes. He's like, I need to stretch my hamstring more. I'm like, no, you don't, dude. Your hamstrings are perfect.
Perfectly fine.
Yeah, I'm like, don't stretch your hamstrings. It's a waste of your time. Do this because this is the exam that we found was problematic for you, and this is how it's interrelated to your pain.
Yeah, and that's why, you know, when we do the physical exam, we come up with a problem list of what you're dealing with, and we, you know, give you a specific program based on what our findings are versus, you know, just doing whatever's out there.
Yeah.
So that,
YouTube, whatever. Yeah. I mean,
Yeah.
Don't waste your time.
Yeah.
Don't make it worse. A lot of patients are like, yeah, I think, you know, yes, there's information out there, but is it good information? Is it applicable to you? I mean, that's my biggest thing is like, you're an N of one. There's nobody else like you. You have to be examined.
Thank you.
Yeah. I mean, that we don't do cookie cutter approach here.
each person
Yeah.
is unique, and yeah,
And deserves is the word, to be treated as a unique individual, not just to herd it in like a cow and you just get the same thing and you're like, why am I here?
We got a procedure for this, procedure for that, and
Yeah.
what is applicable for the particular person as opposed to just the problem.
Yeah, yeah, yeah. Don't get us on our soapbox.
okay.
There is a
We won't have time. We've got good information to keep going.
Yeah.
Yeah, we did.
Yeah.
So the last thing is neurological tests as necessary. Just if you do have some muscle weakness that we found, because the nerves, of course, innervate the muscles, but they also produce sensation. So if you're having like numbness or tingling, that's a sensory issue, and we may need to look at what your sensation is, or check your reflexes to see if certain levels of your spine might be affected or not. If you have like a burning sensation, we would look at that as well. But most of the time, with nonspecific low back pain, it's going to be primarily in the low back area. But, you know, just to keep that in mind with radiating symptoms that can occur.
Thoroughness is important.
And I guess if you see the picture, I like the picture that Dr. Murphy put up here, but it's Sherlock Holmes and Watson, and we're kind of like that group.
Yeah.
We're investigating.
Yeah, instead of
What's going
investigating
on.
a crime.
It's
Right?
a crime to take medications, do injections, or do surgery before you see this team at Pinnacle. Boom!
That's good. Okay.
Mic drop. All right, we're done. We got food
Okay.
over here, so we're going
No,
to
we
just
have
go.
more video to do, guys.
Oh,
We have more video.
Okay.
Okay.
Dessert looks really good. If you're not here, you missed out because we're about to have some dessert after this. Some good stuff. So
Some good snacks.
next time, come.
So, back to the physical exam. When we check your range of motion, when we do mobilization, we try to test and retest to find out what makes your symptoms either better. I mean, we want them to be better, but if it makes them better, worse, or about the same, and then we vary our treatment according to that. So,
Correct.
you know, it may be that we test you one day and you are feeling better, but then the next time you come in and we retest you and maybe your pain level is a little bit more, so then we may have to come up with a different treatment approach
Yep.
at that time. But that's how we figure out whether we're on the right track with helping you to deal with your pain.
100%.
Absolutely.
And then the next one is what to expect after the evaluation. So that's where the fun part comes in. And like I said at the beginning, our main goal is to reduce your pain so that you can get back to normal mobility and function. And exercise is the key to a healthier spine. like we talked about. With that article that I had cited earlier, the physical therapy approach to treatment of low back pain, the thing that I found interesting is that exercise can help calm down pain by triggering pathways in your brain to decrease that pain. And so that's why it's important to get back to your normal exercise routine, even including like a low impact aerobic activity
Walking,
as well.
Yeah, walking, biking. Yeah, some activity. They used to tell you just lay in a hospital bed back in the day. You know,
Yeah.
just, put you in traction, lay in a hospital bed for a week, and then they found that the side effects of that were even worse. Atrophy, and just like it didn't do anything for your symptoms. It was
More complicated, the issues.
Yeah.
So now they tell you keep moving. Like hurt does not always equal harm, which is another important concept that we go over with our patients. Disconnecting that we're not causing damage, we will interpret together your response, and that very unlikely, the pain is causing some kind of damage. That's a big disconnect for patients. It's like pain, sometimes we've got to explore and investigate what's going to work for you. If you're thinking one visit is going to be hallelujah, it's
Or even two.
Yeah.
Right. It just doesn't work like that. So,
And pain is your body's warning system, but it's sometimes there can be a disconnect there to where your body is warning you. The alarms are going off, and the pain isn't injurious to your body like you think it might be. The other thing is like with the weight-bearing exercises, like the walking or treadmill, things like that, it's going to help with increasing your bone density too, because it's putting pressure through your bones, which is important for especially if you have
Osteoporosis.
Yeah.
that and not only that, but your aerobic health too, like your heart, your lungs, cardiovascular, blood flow.
Yeah.
Scott's big on blood flow.
Yeah.
But it's true. I mean, yeah.
So another thing that we can do is manual therapy techniques, and Scott will probably go through some of those, but we can do trigger point release, myofascial release.
There's also the pressure point releases, the points on the body where they generate issues. And so you trace the nervous system, which nerve controls the muscles, so that you are able to trace down the pressure point and trigger points more direct. And so that's where I come in and help with the range of motion, taking the pressure off the muscles, the joints, causing the issues that you have, making you stiff, sore, and achy, whether it be the low back, the back of the knees, or even the glutes, where it hinders your hip rotation, or even the pelvic rotations and movement.
Yeah, all that's interconnected. Yeah.
Absolutely.
Yeah.
And so you could have a problem with your knee. It's problematic shooting up to the low back, because the nerves allow the muscles to move to a certain degree. And if the pressure on the nerves is hindering the muscles from moving, you're not going to be able to function very well, and the pain can travel.
Yeah.
So.
Yes, and so that's why we're
Yeah,
thankful that
yeah.
Scott is here.
Yeah, Scott's the guy that makes our job easier, actually. Yeah. Scott, this person's in a ton of pain. Help them, and then they can move better for us, and they can get stronger, and they can start to
be more mobile,
understand what they need to do for longevity and to keep this pain away and have it not come back. Yeah, so Scott, to have Scott on the team is just invaluable, because sometimes, man, symptoms, you're miserable when you're in pain. All of us. Yeah.
It's hard to move.
And it's a good motivator. And when we can have Scott do what he does to calm things down, and he does such a great job of it, it helps to expedite the end goal, which is you getting back to doing what you enjoy without having to take the drugs, the shots, the surgery, and then have the ownership over it as well too. Know what you need to do to not have to come back. But then
Absolutely.
you refer all of your friends and family because we took care of you, and that's really how we want to do business. We don't want to keep you forever. We want to help you get better, and then you'll be like, wow, the dream team, the Three Stooges of therapy.
If you will.
The Three Stooges, I just thought of that. The Three Stooges of therapy here. I don't, Stooges is probably not the right word, but the three professionals.
Musketeers.
The three,
Yeah, the Three Musketeers.
The three muscular tears.
Muscular tears. I like that. I like that.
Are going to help you get back, and we're going to take care of you. We're going to have fun. It's not a fun process to go through. We try to keep it light. We want to be real with you and help you along that journey. Not just like you're another number. We don't care about who you are. Like,
Absolutely.
yeah.
You're people. I
Yeah.
mean, and it is where you're individuals with individual issues. Something we may see on someone else, you may have some similar issues, but they're yours. So your body's going to respond differently. You had a different life, you had trauma, and that can also conflict with your inability to move and your abilities to move in most respect. So just because we see something different that we haven't seen before doesn't necessarily mean anything bad. It just means that you are unique, and we're just going to do our best to serve you any way we can. If we can't, we will refer you to someone that possibly could, that can help you.
100%. Yeah.
Yeah, absolutely. And then we also will recommend, heat or ice at home. Dr. Murphy does do some dry needling on occasion
Appropriate, yeah.
as needed. And then education is the key also, besides the exercise, because the more you can do to help yourself, the better off you'll be down the road as well. So we'll talk about posture, we'll talk about body mechanics. If you're having problems bending to pick something up off the floor or sitting at your computer at a desk all day, we can give you tips to be able to change what you're doing a little bit, just to help relieve some of the stress on your spine and hopefully decrease the pain in your back as well.
Yeah, 100%. We got to look at the whole picture.
So,
All right, Scotty.
Alrighty. I guess the torch is now to me. So how the neuromuscular system affects low back pain. It's where the nerves and the nervous system of the body is just very intricately laid out and made. Where your issue, okay, yeah. So,
Can you read that?
yeah, I don't have my glasses with me.
Oh,
It's just
okay,
a nice line. So when the nerves of the lower spine are pinched,
Yeah, you can
Here,
look at
you
that
can
one.
look at this one.
Yeah.
oh, thank you so much. Wow. Yeah, sorry about that. Forgot my glasses.
We don't help with vision.
We do our
We know
best,
somebody
though.
who can.
Yeah.
So the nerves of the low spine, when they're pinched and affecting the muscles of the low back, they can cause issues to both sides of the body or individually. So I'm trying to make this as layman terms as possible, and that's where my mind is trying to figure out, but do the best I can. But with the muscular system, what impacts it, of course, is the nervous system. And if you have scoliosis impinging on your nerves, it can cause your low back muscles to grab, in which case you'll be inhibited going down the spine to the glutes, up to the shoulders, the neck. And I mean, just because the low back is far from the neck doesn't necessarily mean it can't go to the neck and affect everything in between.
That's what I think Scott, one of his best skill sets is just figuring out. I mean, his touch is amazing. I mean, it's, yeah. He sees it. He sees the anatomy, and he can understand how that's all interrelated, and then he educates you on some of that stuff
As best as I can.
as best as he can. But you feel better. That's it. That's all you really care about. I care about.
And when I say as best as I can that you can understand it.
Yeah.
And that falls back on the education I received, and understanding how the nervous system behaves. It's interestingly enough that even the nervous system has its own behavior system. Whenever it is over responsive because of, once again, injury, scoliosis, it could be due to childbirth. Even I've seen it even affect after giving birth to a child. Suddenly you have low back pain, you have hip pain, sciatica, things you never had before. And so I look at all of these aspects. How did carrying a baby affect you? So I'll ask questions like, did the baby kick you in certain areas, kick something out of whack that I need to put back into perspective? Like, for example, the spleen. But more than anything else, it's never know. You never know. I've helped with many different issues. So I help with the neurovascular and neurovisceral. That's why for the longest time over in Texas, I refer to myself as a neuromuscular specialist, and that I understand how the nerves are interconnected throughout the body. So I've helped many of my patients with the low back pain. I've helped them with the muscle stiffness and the transfer of pain. For example, sciatica. I mean, there could be many other things you have going on. Stiff knee, coming from the low back, believe it or not, because you don't have just the nerves of the back side of the body, but for the front side of the body. And those come from the front side of the spine or anterior of the spine coming down the quads. So it can affect your quads, your hip flexors, all the way to the top of your feet. I mean, it's just, the only way to know is to feel, palpitate, find the areas that are tight or taut. So hypertension is another factor for the low back pain. That, once again, could be the quads are tight. Loosen the quads, oh my gosh, my back is looser. I've had many of my patients have that reaction.
Finding the root cause. Yeah, I mean, that's really what it comes down to.
Yeah.
Find the root cause. Explore the root cause. Be thorough in your examination. Treat what you see. Treat the impairments. Patients get better.
And that's the key, getting everyone that we see to feel better.
Yep.
So
cool.
that is the ultimate goal. And also, skipped a part, but that's cool. No, it goes into what I'm about to talk about, though. So when it comes to locating trigger points, traditionally, massage therapists will massage and feel for the trigger points, whereas what I like to do is listen to what you tell me, where the pain's coming from. So then I take what you tell me, take it into your care. So I look for those trigger points along where you're feeling the pain so that I can release them, whether it be through manual tendon release, pressure point release, and pressure point release is where I look for the stiffness in the muscles, and that's pressure. So much like when you shake up a Coke bottle and it goes everywhere. Well, when it comes to the pressure point, when I release it, sometimes it has the toxins build up. So when you release the toxins, it then can expel the issues that you have into other systems. And that's why I use the myofascial release to help it and guide the toxins into other parts of the body so that it can be processed.
Washed out. Yeah.
The body knows what to do. I just help it to be able to process things properly. And sometimes it causes a flare-up when you have nervous issues. So with some of the patients that I've seen even this past week, when you have nerve issues like I do, I can't get a massage. If I receive a massage from a normal massage therapist, they will hurt me. So I got to be careful. And so I even do my best to be meticulous with what I use for my patients, because some things I may use may not be suitable for you. But I will do my best to make sure that I think that ahead of time before I apply whatever methods I use. Like even with some of the manual spinal stretches that I use. You know, I want to make sure that I help you with your pain any way I can. Within the scope of practice, of course, but it's where sometimes the spine will give a little tilt to the spinous processes. And so just a slight pressure using a trigger point method can just help everything to find its place of homeostasis or a place of balance. So everything has a flow. But once again, when you do this, whether it's muscular, whether it's with the joints, whichever, the toxin buildup with the pressure points, I can't stress it enough, it can cause pain for a few days. And it's not that I put the pain there, it was already there. I just released it, so now it has to be processed through the body.
Yeah.
And that process can take days.
Can take time. Yeah. I mean, it's just setting that realistic expectation. We're moving things around that maybe haven't moved in some time. We're
Right.
releasing things that
Years.
haven't been released. You know, it is a process, and you have to. Obviously, there's got to be education on our part to give you some expectation, but you know, sometimes we've got to increase some discomfort in order to know, okay, we're on the right path here.
Yeah.
It's confirmatory, really, is what it is. Good, we're on the right path. Let's continue down this path, and we should start seeing a resolution in your symptoms, an improvement in your function, and your quality of life goes up when those things happen.
Yeah, after a couple
Absolutely.
of days.
Yeah.
And it takes sometimes even a week. With some people that have neuromuscular issues, it just happens. It's part of the body's way of healing that was withheld. So now it's released, it's able to heal.
Yeah.
You know, so now it's stretching. You may be feeling more tired. That's because I released the fatigue in the muscle that was locked in place due to the trigger points, due to the pressure points. So just because of the fact that you feel worse, if you will, worse for the wear, because of the fact your body just, it's been in pain long enough and it's ready to release it. It just now needs to process the aftermath of releasing everything. So, and that's where we get into the abilities, what you're able to do. And the difference from where you were when you came in, it's like I don't have the ability to bend over and touch my toes. I can help you to be able to do that. I can help you to be able to exercise better. You can't really twist your forearm because your muscles here in your elbow are tight. So I go in, I release them at the tendon as opposed to just moving stuff along like a normal massage and aimlessly work the body, whereas I target the areas where you're feeling these issues so I can release them So you're able to do a curl, perform it. Or you're able to perform full range of motion exercises. Being able to bring the weights down, or pull the ropes down in front of you with the full range of motion in your shoulders. Without the full range of motion in your shoulders, you can't do that. You can't perform those types of exercises, which could be the rhomboids, could be the shoulders, could be coming from the low back, and it's just a reefer of pain and tension. So, and then helping you to be able to function your everyday without the, like these fine people have talked about. I mean, you don't want to have your pain and stiffness when you leave the office, and I get that. We all get that. But sometimes it takes time before that can occur. But that is the ultimate goal with everyone that comes through our office, is to help you to be able to perform your everyday work or your chores at the house, holding your kids, grandkids. I mean, who doesn't want to have an enriched life? So that's why we're here together as a family, working together as a team to better serve you and to bring you better to your everyday self.
100%. Yeah, well said. Yeah. Cool. Well, our approach to feeling better, this is just what Scott reiterated, function. It's what's important to you. Are we moving in that direction? Are we getting you to back to doing those activities that are important to you? And I think really it's kind of a process that you as the patient has to really ask yourself some questions. Have we helped you to improve your strength, your flexibility? Is your balance better? Do you know what to do to continue on that path of wellness, to see improvement continued in those areas? Do you have a maintenance plan? Hopefully we'll have given you, and I know we'll have given you some things to keep working on. Don't stop doing those things. That's important.
Yeah, because like I said earlier, it's something that, we want to equip you with so that you can hopefully prevent re-injury from occurring, or, if something does happen again, you will know what to do to help
Yourself.
take care
Help
of
Help take care of yourself.
Help
Absolutely.
yourself first, and then call us. Don't just mask it with drugs. Don't for sure get an injection or surgery, God forbid, before you at least come see us. Let us talk with you first. And then even I think this is an important question to ask. Like, we have some patients that they want to be better than just back to normal. They want to be like, you guys are the dream team, the Three Stooges, the Three Musketeers, whatever.
Musketeers.
We're
yeah.
like the Three Musketeers. We're gonna get shirts. We're gonna have costumes next time.
Okay.
The whole night.
Yeah, absolutely.
I'm on a costume kick right
Yes,
now, as
yes.
Kim will tell you.
Have a bunch of trigger point tools or something.
Yeah. It's Halloween, so we'll make sure that we're the Three
That's right.
Musketeers. But no, just better than back to normal, I think, is something that we all strive for. Like, I want to feel better tomorrow than I do today.
Yeah.
Who the heck
Absolutely.
doesn't? Do I have a team of people that are willing to invest in educating me, empowering me to be better? And man, I'm telling you, some of our patients that use us as that team, they're better
Better for
now than they've ever been. And they'll tell you that too. I mean, we're not just tooting our own horn. They'll sit up here and tell you the same thing.
Yeah, and I think that that's where it gets into that maintenance too. We're educating you on overall health and wellness as well. So, like, if you're interested in, how to sleep better, how to relieve stress, how to maintain flexibility throughout your body, cardiovascular endurance, things like that. Those are all so important to helping you to become better than you were when you first started.
Yeah, for sure. Yeah, I've coined that term, your buckets of health. How full is your bucket?
Yeah.
There's a lot of people out there that are doing great things. They're doing flexibility work. They're working on their balance. They're doing their cardio. They're super active. And then there's some people that know they need to be more active. They just don't know where to start.
Yeah.
You know, they're scared, they're nervous, they're in pain. Like, well, who the hell's going to start doing all that stuff if you're in pain? That doesn't make any logical sense. You don't want to do anything when you're in pain.
Right. And that's
Nope. No, sir.
And that's a lot of times we get the patients that come in for pain, but we want to educate you on, oh, wow, it's your dream team. Once again, let's get you better than normal. Let's help you invest in those buckets of your health. Because that's what we have. That's the fountain of youth, honestly. If you look for the fountain of youth, it's you sleep well, you reduce your stress, you eat healthy, you exercise, both strength training and cardiovascular, and that's it. I mean, that really, that you look
Bottom
at,
line.
there's research up the wazoo about those things helping to treat all the conditions that we as Americans and globally deal with. Diabetes, cardiovascular disease, stroke, heart attack, cancers. I mean, you name it. Now, is it easy?
no.
No. I'll be the first to tell you.
It's something you have to kind of make yourself do, but you feel better afterwards.
Yeah.
And
And the team here, I think everybody needs accountability, let's be honest. I mean, there's everybody in some
Absolutely.
facet of their life needs accountability. Let us be your accountability team, because not only do we provide the accountability, but we provide the right information and we get you to where you want to go. So, I mean, that's yeah. So don't just worry about your pain. So what can you do to help yourself? 5 tips, and this is going to be based on some research. We have touched on these also. If you haven't heard the word education, exercise, and manual therapy, you have not been listening. Or you're just tuning in. So those are really important. That's as physical therapists and as neuromuscular massage therapists. It's muscle, it's nerve, your body has to move. That's period, plain and simple. If your body's not moving, you're going to be in some trouble. Avoidance of early imaging, we talked about that. Pharmacological drugs, taking oral medications. I mean, look at the state of Arkansas. It's a sad reality. The opioid epidemic here is worse than in any other state, literally. It is a shame that patients are going to that approach at any stage, but did they really get the care that they needed at the onset that prevented them from having to take that next more invasive step?
Yeah.
That is just unacceptable to me. I get pissed when patients tell me that kind of stuff, that they jump the gun, and it really affects everything. It really does.
Yeah.
Family, your life, your quality of life. I mean, opioids are no joke. I mean, any addiction. I mean, we won't go off on that, but it's like you don't want to go down that route. And most logical people are like, yeah, I don't want to take drugs. It's passive. They know it's treating symptoms.
yeah,
But it's easy too. You know,
It is.
It's easy. Like, oh, I'll just pop some medication and I'll be okay. You know that's not right. We're giving you an option. We're reaching the hand out saying, hey, come, let us help you. 'Cause
Let
we
us
can.
treat you.
Yeah. Psychological factors. We talked about that too. Stress. Do we need to refer you to a mental health counselor? Let's be honest. We all have stuff. Life's hard. Stress, work, kids, money, you name it, economy, politics, you name it. There's a lot of stressors. Is that something we need to make a referral and keep you accountable to going? Because it's part of your progression of wellness. If we ignore that, we've missed an opportunity to really transform your life.
yeah.
And we don't want to do that.
Absolutely.
That's what other people do. We don't do that here. Passive treatments, ultrasound, electrical stimulation, traction, some of those things, they feel good, but the research just doesn't back them. You know, I hate it when a patient's like, oh yeah, I went to physical therapy. My favorite part was when they put the hot pack on and the stimulation, and I'm like, yeah, that's great. You could do that on your own.
Yeah,
You could do that on your own. That's fine. I mean, we'll help you find the right unit. We'll help you. When you're here, we want your time to be very valued and highly skilled, and interventions that you can't do on your own or you need guidance. If you're doing the same stuff that you're doing at home at physical therapy or in your doctor's office, you already know that's a waste of your time. Don't keep wasting time. And then finally, find a facility. This kind of goes along that line. Find a facility where you're being cared for as a person with continuity and a high level of expertise. You owe that to yourself. Find a team that you can trust in. We touched on this too, mobility and stability. We just look at the whole system. That's what we do. We got to find the root cause. If you're treating symptoms, you're in the wrong spot. Go to a provider that wants to dive deeper to find the root cause. Simple. And then this one's a little video, but we all remember the song when you were a kid, the knee bone's connected to the hip bone. It's a fun kid song. I won't play the video just to spare
won't?
you. Yeah,
It's fun.
I could
come
sing.
on.
I could sing, but
It
you
really is
wouldn't
a
want
fun
to hear it.
video.
Yeah, let's do it.
Yeah. I did this for my anatomy class.
Oh, did you?
1 year.
Oh, did you?
I did.
Awesome.
This, yeah, it was fun.
Oh, good.
Oh yeah, I'm doing
Oh,
I'm doing
you're
on your
a computer.
I'm like, hold on a second.
This is fun. This is great. Yeah.
Why is it not going on this one?
Huh.
Let's see if I can play. Oh, there it is. Play video. This thing's smarter than me. See, technology, I tell you. Oops. Crack.
Oops.
It might just have to be in that small pane. I can't get it in the bigger one.
Dancing bones? Really?
It's true, man. I'm telling you, it's it doesn't. It's a funny song, but it's a very true song, and
Absolutely.
you gotta go to somebody that's gonna look at the whole system. That's just plain and simple. Because if not, you're missing the boat. So as a synopsis, today we talked about what's wrong. We talked about anatomical approach to low back pain, and then maybe more of a biopsychosocial approach, which is like treating the whole patient. We talked about that. We talked about our unique approach here, the three musketeers here at Pinnacle, and how we take a very structured approach to helping you get out of pain and get back to what you want to do. Plain and simple. That's it. We do it. We talk a lot of fancy words and stuff like that. At the end of the day, it's what you want. Out of pain. Brian, I don't have patients like Brian. Some patients want to know the details, which is fantastic. That's great. Education and an active participation helps you understand and kind of do the things that we're going to need you to do. Because honestly, it's a two-way street. If you don't do what we ask you to do and you're not going to be active and you're not going to impart some of these
Be
changes,
proactive.
yeah, it's not going to work for you.
Yeah.
We're on this journey together. We're walking together down this path, and patients get better when they do that. And then finally, we talked about those 5 tips that you can use to help yourself. So, that logical question, maybe you joined us online, maybe you joined us in here, you heard about the wine, you heard about the food, and then you realized, oh, it wasn't about the wine and food, it was about the 3 musketeers. And I came here and I have found the answer. I have found the answer. You thought it was just going to be about food, but then you came and you were enlightened.
We came, we saw, we loved it.
Yes, exactly. So just asking yourself that question, why are you still struggling? After everything you've tried, why are you still allowing back pain to dictate your life? And then thinking through, damn, I've seen 5 people. I've seen chiropractor, I've seen fluff and buff massage therapist, which is not Scott. I've seen other PTs. I felt like a cow being herded around, and somebody was telling me to do my exercises that I already did at home. Don't waste your time. This is the solution, or at least we're going to give it a damn good go. Trust me on that. If this doesn't work, then with confidence you can start moving. Like, okay, maybe I do need to get that MRI. Maybe I do need to get that X-ray. Because you got to give it a go. Before you jump down that more invasive route. So today could be your lucky day. It could be a start of your new and improved reduced pain lifestyle. Like we said, low back pain, we talked about it in the beginning. So prevalent. We see it every day. We've treated the variety of patients with all of those different types of low back pain that we talked about with great outcomes. But like I said, it has to be based on an exam that is of you, that's very thorough, and a plan of action going forward that is very, very catered and very specific to you. That is what we do here at Pinnacle.
Absolutely.
So we shared some of our contact information. Our office is on the corner, well, pretty close to the corner of Sandpeck and Cantrell. Our phone number's there, 501-529-2010. Denise is our patient care coordinator. She's fantastic. My email's on there. If you had specific questions for Dr. Weiner or Scott Buck, you could shoot me an email. I can convey that information. So we do a couple things because you're here most likely, unless you came for the food, you're here for something about my back, and here's a few options for you. So we do a free discovery visit, and that's an opportunity for you to sit down with either Kim, Dr. Weiner, or myself to say, here is my specific situation. I've got some questions. Do you guys think that this is something that you can help with? We can answer questions of yours. We can get some more information from you. We can give you some confidence in making a good decision for you, whether you want to try the 3 Musketeers.
Absolutely.
Yeah, so that's a great, I don't know any other facility that does that, and I think just the transparency of this is who we are, this is what we do, we want to hear your story, we want to make sure we can help you before we go down that hole. So, down that route for you. So take us up on that free discovery visit. Or if you know for sure, you're like, okay, 3 Musketeers, Salvation, we've come to the mountaintop, they're my team, I want to come, I want to experience what they do. We're going to offer $50 off our full body assessment. And that's where, like we talked about, spend 75 to 90 minutes with you looking from top to bottom, finding where those impairments are, finding the root cause of the problem, giving you some things to get started with, and then very clearly saying this is what we feel like is going to be appropriate for you to get back to golf, get back to picking up your grandkids, get back to playing tennis with your friends, whatever it might be. So that's another option if you are gung-ho and ready. And obviously these options are for somebody, hopefully just like yourself, that doesn't want to continue to take medications. They're scared of having to do surgery. They don't want to do injections. They don't want to get the x-rays. So if that's you, one of these 2 options is perfect for you. If you're ready to go, we'd love to have you. We'd love to serve you here. If you're still a little hesitant, please come in for the discovery visit. Sit down with one of us, get to know us a little bit better, and just get confirmation that it is something, your specific case, that we can help you with.
Absolutely.
Yeah. And we'll let you know, if we can help you or if we need to refer you.
Yeah.
Absolutely.
I've had numerous patients that have taken me up on that discovery visit, and I'm like, man, call up one of my orthopedic colleagues and say, hey, this patient needs hip surgery tomorrow. And that just saved you a lot of time. It saved us a lot of time. Those things happen. And that is just something we at Pinnacle, this team is always going to do what's right by our patients, period. Not for our own gain. It will be, trust me, all for the benefit of the patient. I don't care if it's dancing in the rain that makes you feel better. We'll help you dance in the rain. If it's a referral to somebody else, we'll get you to one of our colleagues in town that's going to take care of you to that same level that you're going to be taken care of here. So, but if you want to sign up for that, of course, if you're here in person, you can just kind of chat with us after. If you're on Facebook, you can reach out to Denise. You can even text her at that number. It's 501-529-2010. Denise will ask some preliminary questions of you. She's our patient care coordinator, and then, or you can email me at Brian, BRIAN, at pinnacledpt.com, and I can answer any questions or convey messages to Dr. Weiner or Scott, and we can get you started.
Absolutely.
A couple of our websites. I've got, well, it's really kind of the same website, but I do some specific golf work with golfers on the pain side and the performance side, so you can look at that. You can find out some more information about us on the website. Check our Google reviews. Honestly, those are where patients tell their own stories. We could say we're the Three Musketeers, we're the best things ever. Talk to our patients, look on Google, they'll tell you our story, and they'll hopefully vouch for us that we've helped them in similar situations that you're finding yourself right now. So don't just take the word from us. Some references. We talked about a bunch of articles. There are those if you want to peruse that. And then, of course, we'll do any questions that you have now, questions that were posed earlier in the Facebook Live, or for people here at the presentation. And we just thank you guys for being attentive and listening, and
Thank you so much.
Yeah, we appreciate it.
helping you reach your pinnacle.
So we do actually have a question from Brenda. She said, what approach would you take with someone that has already had 2 back surgeries and also a neck surgery?
Well, we would just go through the same
Assessment.
assessment that we've done, where we would take a look at your history. We would
And
look at your range of motion, your strength. I mean, we would just assess you like we would anyone else, and try to come up with a plan of care for you.
Yeah, I mean, that's
That is-
not necessarily, that obviously has its own nuances of things that you may be now limited in doing because you had surgery, and our expectation of like normal functioning of joints, depending on what types of surgeries you've had, or what are the side effects of those surgeries that I know Scott would address, of potentially scar tissue, adhesions of the nerves, blood
Absolutely.
flow restrictions, hypertonic muscles, trigger points, you name it. Like how much of the pain is being generated from the spine versus other soft tissue structures versus, you're afraid to move because you have pain. You're an N of 1. So, I mean, we would examine you thoroughly. What are your goals? What have you tried? Just addressing all of those specific facets to come up with a plan that not only do we think is the right plan for you, but you yourself have say in, oh yeah, I think that
think
makes
that-
sense.
yeah,
Scott,
absolutely.
I understand. Like, it's a two-way street, It's crazy how many sometimes patients are just so passive. I'm like, tell me what you think, This is your
Please.
plan too, I'm not yes, I went to
I
school for
have
this
the
stuff, but
knowledge, but
Yeah.
it's your body.
yeah.
I mean,
And
that
do
is-
you agree? Do you not agree? I mean,
Yeah.
let's talk through this. I mean, we really
we're on this
want
journey together.
a dialogue with our patients. So
And even if you've had 3 surgeries, we can still help you. That doesn't make
that doesn't
you
mean
a
you're
lost
good.
cause or
Yeah,
anything. It's-
absolutely
I mean,
not.
We
Absolutely
can
not.
we can work on soft tissue and mobility and flexibility.
Yeah.
So.
And education. I
Yeah.
mean, that's huge for patients that have needed surgery to understand, well, what does life mean now that you've had that surgery? What are you still dealing with? What are your goals? And how can we get you there in a way that is going to help you remain active, reduce your pain, whatever kind of your specific goal is. But yeah, I mean, you're not a lost cause, that's for sure.
No.
She said, it sounds like there may be hope for me from the Three Musketeers.
Nice.
Wonderful. Thank you. Thank you
Yeah.
for listening.
Yeah,
Thank
that's
you.
great. Yeah, please reach out to us. We'd love. Was
would-
it Brenda?
Brenda Daniels.
Brenda Daniels. Oh, okay. Oh, cool.
Awesome.
Yeah. No, we'd love to chat with you, Brenda, about specifically your story and what we can do to help you, for sure. Were there any other questions?
That's it.
Okay. Awesome. Well,
Well, thank you.
Thank you.
we're here.
All right.
Have a
For
great
your time.
night.
Have a good night. Happy Halloween.